The Africa Centers for Disease Control has concerns of accessing as much medical equipment as needed to combat COVID-19 in the continent. It said what made matters worse is the stiff competition that comes from the developed world for same medical consignments.
We are competing with many, with the developed world in terms of access to these diagnostics. We are competing with the developed world in terms of access to commodities that are required for prevention. There is the PPEs, there is the personal protective equipment, and other things that you are aware of.
The number of coronavirus cases in Africa is mounting every day, and so is the recovery rate. Still, the Africa CDC says it's finding it hard to establish the exact number of people with the virus due to weak capacity of diagnosis across the continent.
There's one thing to have diagnostics at the central level, and there's another thing to have diagnostics across the health system there, which is what we are working very hard with our partners to have that. Unless and until you do that, you cannot find the cases, isolate them, and follow their contacts there. That is the importance of testing there. So we are challenged there, and because we are challenged there, it's fair to also say that we may not actually know how the size of our problem until we address that.
African states are now advised to continue strengthening their testing and prevention capacities by all means necessary. Some use bilateral and others multilateral means to meet their needs. And already from China to European states to the United States, many are showing Africa the much needed gesture of solidarity in fighting the coronavirus. Grumtala, CGTN, Addis Ababa, Ethiopia.